childhood obesity is so difficult to treat, and an obese child becomes an obese adolescent. Food labeling needs to change in India, and it has to become mandatory. Eat less and walk more is the mantra for weight loss. It isn't.
Thank you, Dr. Neeta, for joining us in Health Spark. Thanks a lot for giving us your time, and I hope our viewers would gain a lot of insights from your talk. So, my first question would be, since you work extensively on obesity and diabetes, what are the unique challenges that India faces vis-a-vis obesity? Because in Indian context, obesity is still not that recognized a disease as per se.
Right. So the unique challenge is that we are what they call thin fat Indians. That is, we could be looking thin on the outside, but we are fat on the inside because being thin or fat is not just a question of body mass index. So that is traditionally used as a measure of obesity. However, that may not be accurate because it does not tell you one, how much of the weight is fat, that's the fat percentage. And second, it does not tell you where that fat is located. And we all know that central or visceral obesity is the worst kind of fat metabolically. And therefore, it is very erroneous to use only the body mass index, especially for Indians. However, having said that, I would also say that Indians are also becoming heavier, even in terms of body mass index, because of urbanization, mechanization, and the different kinds of sedentary lifestyles that we are adopting. So that is a challenge. The second challenge, as across the globe, is that most people think that it is in their control. They think they can diet, they can exercise, and they can get back to any weight that they want. So most people think that it is not a disease, but it's just a question of, however, they fail to realize that weight loss can happen, but then the biology takes over. And the hormonal changes that occur after you've lost weight with lifestyle measures makes you go back to the original weight. So that is the second challenge that people do not understand. Third challenge is that most people in India, at least, are averse to taking medication to lose weight, averse to bariatric surgery, even if they are extremely heavy. And they want to do everything only by natural means, by diet and exercise, which is not possible. So these are many, and plus our dietary habits.
Right.
Across the board, we are all carb eaters, basically carbohydrate rich diets in India. That is not very conducive to weight loss. And that is our next challenge to, make people change the way they eat. So these are a few of the, not limited to this, there are many more, but these are the main challenges.
So, my follow-up question on this would be that, how do these socioeconomic factors, how does a person live in a society, people from urban areas, people from rural areas, what impacts do they face when they are having, a disease like obesity, which they think that is normal, it's not something which is unusual.
Well, in the rural areas, being a little on the heavier side is supposed to be good. It's supposed to be, giving a personality to that person, and, basically a luxurious kind of a mindset. So they do not think of weight loss unless they're in trouble for something, or they go for some knee problem or a gallbladder problem, and the doctor tells them that you need to lose weight. Until that time, they don't even realize that they're overweight. So in the rural areas, that is a problem. And uh, believe me, even the rural people are getting obese because mechanization and change in eating habits has happened even there. The world has become is shrunk as such. Even the rural people are not exempt. In urban areas, of course, there are other forces at play. People are, looking at showbiz, and they are looking at social media, and they want to get thinner for different reasons. But again, there are problems of bad lifestyles, worse lifestyles than the rural areas. So challenges are there on both the sides.
So, I mean, also we are facing a recent phenomenon that we see a lot of younger people facing obesity, and because of that, also getting trapped into this cycle of diabetes, having a lot of cardiovascular diseases.
Absolutely true. And that is because these very same habits are catching them so young. And a childhood obesity is so difficult to treat. And an obese child becomes an obese adolescent and continues to become an obese adult. It's so much more difficult to get people to a normal weight if they have been obese since childhood. And if you look at the leisure time activity, if you look at the way the kids are eating nowadays, the way Swiggy and Zomato has taken over the lives of people in urban areas, if you look at all that, these are all the factors that have led to childhood obesity. And it's becoming very difficult to change that. What they carry maybe in their tiffin boxes to school. So all of that has changed, and that is why childhood obesity is on the rise. And that's not a very nice thing because we have maturity onset, or let's say adult diabetes coming in adolescents and children because of these reasons.
So, I mean, what kind of impact this obesity, especially in children, have on their mental state? Because in the end, you go to the society, you have a
Right.
specific kind of image to have in the.
Yes.
Yes.
Yes, there is, in fact, children and adolescents face it even more. There is a lot of stigmatization and bias against people who have obesity. Their own image of themselves, their body image, they have severe issues with that, and this can lead to eating disorders. It can, like bulimia or anorexia for that matter, or it can lead to depression. It can lead to a lot of anxiety issues. So a lot of mental issues can crop up in childhood obesity or adolescent obesity because there is so much of peer pressure to look a certain way. And if they cannot match up to that because of their body size and their body image, it is going to lead, and they are very vulnerable at that age, and it leads to a lot of mental issues. And that really is very serious.
So, I mean, what role can schools and government play in ensuring that this does not happen?
Well, a lot of awareness has to go in. Especially, I think that they have nutrition for parents and nutrition for children needs to start in school itself, and there has to be there are certain schools, in fact, that insist on homemade food, home cooked food, no bakery food, no breads, those kind of things. Some schools do insist. So there can be certain rules that the schools can bring about. There can be awareness programs for by good nutritionists for the parents. There can be more time for physical activity in the schools. So rather than just 1 hour, maybe like once in 3 days or something like that. So these are some of the policy changes that can happen at the school and college level. At the governmental level, not only for children but even for adults, I think good proper labeling of food labeling needs to change in India, and it has to become mandatory, and it has to uh, specify not only the ingredients but the carb, the all the ingredients, in fact, what it contains, the trans fat and all of that, and the calories, the proteins, the carbs, fats, everything needs to go into that very, very clearly. And in
Right.
fact, just like cigarette smoking is injurious to health, there has to be some labeling policy for foods that are really, really very high in calories and carbs, and that labeling should warn people that this really exists.
I would just go back to the first answer that you gave. Why in India are people so scared about taking medications or going for surgery for an issue like this?
Yeah, because a lot of people think that eat less and walk more is the mantra for weight loss. It isn't, because eat less and walk more is just small part of the story. Now, for example, if you and I were both trying to lose weight and both of us ate the same amount and walked the same amount, we would lose weight at different rates. because that is decided by how much muscle mass you have, what your metabolic rate is, what your genetics are. So eat less and walk more is a very, very blanket kind of a statement. And that is what people refuse to believe. Secondly, there is a lot of misconception about allopathic, or let's say modern medicine drugs, in the minds of people in India, that they have a lot of side effects, your organs are going to be affected, and all of that. So that is the second reason why people don't want. And the third thing is, they don't see obesity as a disease at all. So if it's not a disease, why do I take a medicine?
Right.
So that's the concept, where they don't realize that obesity is a disease. It can cause anything from diabetes all the way up to cancer. So, since it is, so you call it a risk factor or you call it the cause for these diseases, people have to understand that, and that I feel somewhere as healthcare professionals we are lacking in. We need to create that awareness, put it out there for people to see that this is the connection between diabetes and obesity, between obesity and cancer. We need to keep harping upon that and talking to our patients. So that's
Right.
what it
And
is.
but we also see these days a lot of Instagram ads on social media promising weight reduction in 15 days, 20 days. I mean,
Yeah.
what's your take on that?
Well, I do not think that is scientific. There could be a lot of different things that people are using. People talk about detox and they talk about Garcinia Cambogia. They talk about some juices and this and that, apple cider vinegar and what have you. But the thing is that the most scientific thing that is there is that there is a biology in place. Your gut talks to your brain, and your brain talks to the rest of your body, and all these signals, these cues, the appetite center, the satiety center, all these things in the brain, there is a science to it. And unless there is evidence, hardcore evidence that something works, I don't think it should be adopted. So
Right.
people, and obesity has become such a big problem, it has become such a social stigma that people are looking for a quick fix. They're looking for that magic bullet, and they get taken in. Oh, if it's on Instagram, it must be true, let me try it out, it won't harm me, those kind of things, but doesn't help in the long run.
Right. So my final question, what would be your advice to our viewers and vis-a-vis obesity, diabetes, cardiovascular diseases?
Yes. So metabolic disorders is the umbrella under which all these diseases come. So diabetes, cardiovascular disease, hypertension, obesity, fatty liver, PCOS, all of these come under the umbrella of metabolic diseases. The common soil for all of these is obesity and insulin resistance. So the fact is that you need to lose weight. And if you have to lose weight, it has to be done, one, very scientifically, with a person who is properly qualified to treat. And the second thing is it has to be sustainable. And the third thing is that the viewers or a patient of obesity needs to take and listen to advice and adhere to it, even if it is not in keeping with his mindset. Because what is scientific is not always palatable.
Right.
Right.
Thanks a lot, Dr. Neeta, for giving us your time. Thanks a lot.
Thank you.